15 years ago, communities in Northern Ontario routinely contended with a shortage of doctors and had no medical school of their own to train some. That changed with the creation of the Northern Ontario School of Medicine, NOSM for short. Dr. Roger Strasser, the school's founding dean, is stepping down this summer, but before he goes, we wanted to find out more about what it took to establish a school that's now world-renowned in the field of rural and remote medicine, and Dr. Strasser joins us now for more. Great to see you again.
And you.
Let's do the full disclosure thing up top. What university is NOSM affiliated with?
Well, both Lakehead and Laurentian University.
And do I have some kind of role at Laurentian?
I have a sense you do. You could be the Chancellor.
I could be. So
that's why I keep seeing you at convocations.
that explains it. So we just put that out there for everybody's edification. I want to take you back. 2002, you get a call asking you to move from your home and native land, which is Australia, to Northern Ontario to set up a medical school. What did your 5 young children say to you when you told them you were going to move halfway around the world?
I would have to say they were not especially pleased. In fact, for the first year, they never missed an opportunity to tell us how we had completely ruined their lives and they would never forgive us.
And in 2005, when the Northern Ontario School of Medicine opened its doors, Premier Dalton McGuinty was the Premier at the time, was there for the ribbon cutting. And your 15-year-old daughter and the Premier exchanged some words, apparently. What were those words?
Well, Mr. McGuinty actually thanked Bridget for when I said, well, we're going to Canada to start a medical school. He said, well, thank you for saying yes. Bridget said, we said no.
So with the fullness of time, they're okay with the decision now?
Now they are, yes, indeed.
At the time, not so much?
Not so much.
Well, they weren't alone because you were, I think it's fair to say, a pretty unknown entity in Northern Ontario. I gather the former mayor of Sault Ste. Marie said to you, or asked you in public if you were a snake oil salesman. So let's find out, how much skepticism was there from the locals about what you were trying to achieve?
Well, quite a lot, really. I mean, in a sense, it's understandable because, in rural areas generally, Northern Ontario in particular, it's standard, really, for the government to make an announcement and then nothing happens. The government announces the same thing again and then nothing happens. And eventually nothing happens. And the fact that I moved with my wife, Sarah, who's also in academic family medicine, and the 5 children, all the way from the other side of the world, didn't mean it was going to happen this time.
And yet it did this time.
Yet it did.
Before NOSM was created and before you started training locals to become doctors and serve the population of which they were a part, what was it like trying to get doctors to serve in remote parts of Northern Ontario?
Well, it was pretty tough from what I hear. I mean, really, there'd never been enough doctors or other health workforce in Northern Ontario, and the health status of the people in the north was worse than the rest of the province. So it was a pretty dire situation, and I think that was really what motivated people across Northern Ontario to come together and to advocate to have their own Northern Ontario School of Medicine.
I gather back in the day, if you graduated from U of T or Mac or whatever, some school in the south, and you ended up practicing in, say, Thunder Bay or Sudbury or Timmins or the Sioux or whatever, you were considered a bit of a failure. Is that right?
Pretty much, yes. So the standard model of medical education, as it was then, really occurred in the big cities and most of the clinical learning in the big acute hospitals, the teaching hospitals or academic health science centres. And so, well, the senior teachers and clinical role models of the students were specialists and subspecialists in those big city hospitals. And their view is, they're the best kind of doctor you can be. And so, if you become a specialist in another hospital in the city, that's probably okay. If you go into family practice, doubtful. But into rural practice, that's tantamount to failure.
Well, here is some of what you've been able to achieve over the last 14 years. Sheldon, you want to bring this graphic up, and I'll read it out loud for those listening on podcast. 94% of graduates who have finished both their medical doctorates and residency programs at NOSM are currently practicing in Northern Ontario. 94%. Since 2011, 194 family physicians who were taught at NOSM now practice in Northern Ontario, and they provide care to about 228,000 Northern Ontarians. 92% of medical doctorate students come from Northern Ontario, 8% are from rural and remote regions in Canada, And here's some more breakdown. 22% are Francophone, 12% are from Indigenous communities. And in 2017, the last year for which figures are available, it was estimated that the Northern Ontario School of Medicine added as much as $134 million to the Northern Ontario economy. This is the key, right? The idea is you're more likely to have doctors practicing in the North if they're actually trained and of the North. And it's turned out to be true. Is that right?
Absolutely. So from the beginning, we really focused on recruiting students who had grown up in Northern Ontario. In fact, 92% of our medical students have grown up in Northern Ontario. The other 8% come from remote and rural parts of the rest of Canada. We provide them with much of the clinical learning actually in the Northern Ontario community and clinical settings. So not in the big teaching hospital that I described before, but in a whole range of hospital and health services right across Northern Ontario. In fact, we have over 90 sites where our students and our residents, our other learners may undertake part of their clinical learning.
And are those 90 sites all in the North and in remote and rural areas?
Absolutely. Remote and rural parts of Northern Ontario, including the most remote fly-in, fly-out First Nations.
How does, it's hard to explain to people in Northern Ontario in some respects. If you drive down University Avenue in Toronto, you've basically got 6 hospitals within a stone's throw of where you're driving your car. That is not the case in Northern Ontario. How is it different practicing medicine there versus down here?
Well, I would say if you compare rural practitioners to their metropolitan counterparts, rural practitioners are what I call extended generalists. They provide a wider range of services, carry a higher level of clinical responsibility in relative professional isolation. And that's true whether you're talking about family physicians or pediatricians or surgeons or any other member of the medical profession, in fact, other health professionals as well. So nurses and physiotherapists and pharmacists who are rural practitioners have to be extended generalists.
Is the kind of stuff that your doctors would see in Northern Ontario different from what the family docs down here would see?
Well, in the sense that the family docs in Northern Ontario, they are the first line of care for any kind of clinical problem, whereas in the cities, people may self-select to go straight to the emergency department, or they may go to a drop-in clinic, or they may go somewhere else. In Northern Ontario, if they go to the emergency department, it's the same family doctor that they would see in the clinic.
But the kinds of injuries, the kinds of accidents, the kinds of whatever doctors deal with in the North, is it different from the South, generally speaking?
Well, it's the full spectrum of what might happen anywhere. It is true that there's a higher rate of injuries and other sort of health issues. In fact, cardiovascular problems are more common. There are a range of health issues that the rate is higher in the North. I think the issue, though, is that the rural practitioners have to be ready and able to handle whatever comes through the door.
Right. So, can you give me an example of a call that a Northern Ontario or a remote or rural doctor would get that is really quite unique to Northern Ontario, and you just wouldn't get that kind of call down here?
Well, and for example, an injury in the mine or in the forestry setting, or maybe a tourist. You don't get too many fish hooks caught in any part of the body in downtown Toronto.
Oh, that is true. That is true. One other added complication, I suspect, is the fact that being a rural doc means you don't just know your patients as patients, but you bump into them at the grocery store, you may be their neighbor. How does that complicate matters?
Well, you're right. In most cases, rural practitioners live in the community they serve, and so that, of course, creates particular potential challenges in terms of confidentiality, and that's a challenge for the doctor. On the other hand, it creates opportunities as well, because they see people, as you say, in the grocery store, or maybe they're on the same sporting team or go to the same church or something like that. And so they get to know people in different settings, and they actually have the opportunity to influence the health of the population at a whole population level in a way that the doctors just seeing one patient at a time in the city don't have.
Now, let me flip it around. Could one of your docs, having been trained, 400 kilometers north of here, could you drop them into an ER department at one of the hospitals on University Avenue, and how would they do?
Well, they do very well because they're well trained and well prepared to practice really anywhere. I think what they'd find surprising is that very quickly problems that come into the city emergency department get differentiated and go down that corridor or another corridor, and there are other doctors and nursing staff that look after them. I remember hearing the story once of a doctor who works in the emergency department in the city. He was doing a locum, like covering in a small community, a rural emergency department. And a multi-trauma was coming in, and the doctor said, well, this is the point I call the trauma team. And then, of course, the nurse pointed out to him, he is the trauma team.
That's it. That's exactly right. Well, your medical school got a little more famous than it might otherwise have been, thanks to a TV show we used to do here at TVO. I see you smiling already because you know where I'm going with this. Here's a little sequence from Hard Rock Medical, based on you guys. Sheldon, if you would.
As you know, our first-year cohorts have been rolling up their sleeves for the last 4 months, embedded in pairs in a variety of challenging placements, one of them being ride-alongs.
Hey, mate, what's your name?
I'm Brian.
Brian, my name's Gary. Your daughter's in the ambulance, she's doing fine.
Daddy, where are you?
Whoa, hey. You know what Daddy is? He's with the good guys.
These students are learning firsthand what emergency medicine is all about, learning triage and making split-second decisions. Another pair of students are doing a turn in a small community hospital with situations that are life and death.
Oh, God, I feel a lot of pressure.
Yeah, push, push. I see that, I see that. Here he comes.
Oh, my God.
Clear.
Okay, I want to know how obviously true to life that show was based on what you were really seeing at NOSM.
Well, it was and it wasn't. It's true that Hard Rock Medical was loosely inspired by NOSM, and certainly the notion that the students were out in Northern Ontario, in the rural areas, to do their clinical learning is exactly the same, really, as NOSM. On the other hand, there were details that are different. So, for example, the first season, most of the classroom settings were around the cadavers, the dead bodies, as the students were studying their anatomy. We don't actually use cadavers. So that was a difference.
How about, it was a bit of a soap opera as well, and you had, students involved with each other and, some shenanigans going, lives falling apart, and, all the stuff you'd like to see in a TV soap opera. Mm-hmm. I mean, some of that happens, I assume, in your life as well?
Possible. But I would say that program really helped people in Northern Ontario appreciate the school. I mean, I would be regularly stopped in the street and asked, is it really like that at NOSM?
And you would say, well, yes or no.
Well, exactly.
So, sort of yes, sort of no.
Yeah.
The North, of course, is full of remote Indigenous communities, and I wonder how it is that you get your docs adequate training so that they know what they're going to face when they go to those places.
Well, we were very fortunate because the leadership of the Indigenous organisations really came to us and they said what they needed, what they were looking for from their medical school in Northern Ontario, and one of the recommendations was for our students to have an early immersive experience in their communities. So our medical students in first year, they have 4 weeks living and learning in Indigenous communities, and that includes the most remote fly-in, fly-out communities in Northern Ontario.
How valuable is that experience?
Oh, hugely valuable. I mean, really the students are there to learn from the community about the history, the tradition, the culture, the social and the health issues, and for most of our students, it's a life-transforming experience.
Now, I noticed earlier you do have a contingent of students, I think it was about, 12%, who are Indigenous. Is it fair to say that the other 88% of the students that go through NOSM would have a heightened understanding of, what is required to treat Indigenous patients in a way that if you graduated from a school in the South, you might not have?
That is the intent, and in fact, there's been some research that shows that. There was a study done by University of Toronto researchers in Kenora, and it was the staff and the patients of a service, an Indigenous health service there, and that's what they found, that the NOSM graduates had greater understanding and more sensitive and responsive to the cultural dimensions and the health issues of the Indigenous patients.
Dr. Strasser, I take no joy in raising this, but there has been some controversy at NOSM, and so I'm going to put it on the table. Dr. Anna Safavi, is that how she says her name?
I believe so.
A Sudbury doctor recently once said that one of the faculty members at NOSM issued demeaning sexual and racially oriented comments in front of other NOSM staff. She said she's been suspended from her residency program. She's been encouraged by your school to reveal who the harasser is. What's the status of this right now?
Well, as you can appreciate, this is deeply confidential and I can't really comment on the specifics of this case at all. I can say that there was published recently a study undertaken by NOSM faculty members and one of our students, as well as faculty members from other schools, showing that there are issues in the experience of medical students and the way that they're treated in community and clinic, especially clinical settings like hospitals. And so that is a concern, and it's a concern that we take very seriously at NOSM.
Who's investigating this right now?
Well, we have an independent third-party investigator who's looking into this case.
No police investigation at this point?
Not at this stage.
Okay. Let's get to the future. Who's replacing you?
Well, Dr. Sarita Verma is going to take over from me in July. I really can't think of anyone better suited to take on this role. I've known Sarita, actually I met her even before I moved here from Australia, and she's had vast experience with Queen's University, University of Toronto, and most recently as the Vice President Education at the Association of Faculties of Medicine of Canada. So that's all the medical schools in Canada. So she's great experience in medical education, a deep understanding of social accountability. Social accountability is the mandate we have. That's the focus on improving the health of the people and communities of Northern Ontario. And she doesn't know Northern Ontario yet, but she's looking forward to learning and getting to know the people and the communities and working with the team we have at NOSM.
You know, I'm glad you're happy with your replacement, but this place has been your baby. Is it a little weird to be turning it over to somebody else?
Yeah. I have to say, I'm still getting used to the idea. And other people tell me they're getting used to the idea of NOSM without me in this role. So it's a bit of both, getting used to NOSM without me and for me to getting used to me without NOSM, if you like.
In your decade and a half there, as you think back, what's something that makes you proud?
Oh, I would say seeing our graduates providing healthcare in Northern Ontario, actually more than that, many of our graduates in Northern Ontario are faculty members, and some of them are even taking on academic leadership positions. So we have, for example, Paul Miron. Dr. Paul Miron is a family doctor now in Timmins, and he's the program director for our residency program in family medicine, and that's for the whole of Northern Ontario. So it's wonderful to see people like Dr. Alex Anawati, who is a graduate from our charter class, now emergency physician in Sudbury, and he's become really a crusader for an evangelist for social accountability, and he's recently persuaded the hospital in Sudbury, Health Sciences North, to include social accountability in their strategic plan.
Any students that have gone through that you thought, boy, there's no way in heck that person's going to get through and they're not going to make it, and then they do and they go on to have a nice career?
Oh yes, of course. We have students who struggle and along the way, and it's quite remarkable how much there's a sense of collegiality and assistance. I remember some years ago at Orientation Week, we had both a graduate and also later year students saying to the new first year students, the competition's over. We're here, we're all here to help you to be successful. Most of our classroom learning is in small groups, so they're learning in teams and they're supporting each other.
All for one and one for all.
That's it.
Does it really work that way?
Yes, it does. Yes, at NOSM it does.
Because down south I hear different stories.
Yes, well, that's different down south.
What's next for you?
Well, it's a good question. I actually have what's called administrative leave, so I'll be on the payroll of the medical school for some time, which gives me the opportunity to continue with the special projects and research activities that I have, and to take my time, draw breath, before I decide what the next big challenge might be.
Do you expect to stay connected to Northern Ontario in some way?
Oh, absolutely, yes. I mean, that much of that research and those projects are in Northern Ontario. I'm on a couple of boards, so I'll be around from time to time. I'm not going to be in Northern Ontario all the time. I need, especially in the early times, to allow Dr. Verma to take charge of the school. But then after that, I'll be around, and I'll be keen to help Dr. Verma and everyone else really continued with the growth and development of the school.
And one last thing, and that is, do you know if there are any other states or countries around the world that have kind of stolen is the wrong word, but you know what I'm saying, taken up this idea and used it in their countries as well?
Yes, there are examples where, in fact, schools or part of our model have been taken up in other countries. Let me tell you about Finnmark County, which is in the far, far north of Norway. They actually introduced what they call the Finnmark model, where the medical students have 2 years living and learning in small communities in Finnmark. This is inside the Arctic Circle, associated with the medical school at Tromsø University. And now the government of Norway is saying, well, we need to have more medical graduates, and they're looking at transferring the Finnmark model to other parts of rural Norway.
Terrific. Well, we thank you very much for making the trek down the Highway 400 and all the way to our studio, and we wish you well with whatever comes next for you.
Thank you very much.
That's Dr. Roger Strasser, the Dean and CEO of the Northern Ontario School of Medicine, NOSM for short.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.